don't think a young child is matured enough.
It is very, very,
messy.
very
Oh, I like it. All right. Welcome to another episode of Messy Medicine. We are 4 board-certified physicians here combating fake news by providing you with evidence-based medicine and knowledge. To my left, Dr. Chris Ibikunle. To my immediate right, Dr. Jocelyn Slaughter. And to my far right, my boy, Dr. Nicholas Jones. And I am Dr. Marc Jean-Gilles. Welcome to another episode of Messy Medicine. Today we're going to discuss a topic that seems to get everybody so riled up, especially like during this political season. We're going to talk about transgender medicine. Is it scientific or not? And that's what we're going to talk about. So let's just start off. As you know, gender dysphoria is a hot topic, and we want you to share with us what you know about it, surgical procedures, and we want to ask the following: transgender medicine being scientific, is that real or fake?
It's real.
So you think transgender medicine is like?
It's a real thing, yeah.
No,
Absolutely.
let me rephrase the question. Is there good scientific support for transgender medicine, especially like in children?
I would say
Real or fake?
I don't think there's enough support.
Which sign you gonna raise, buddy?
I'm gonna say it's messy.
Oh, I like it. All right. Jocelyn?
This thing gonna get raised a lot. It is very, very, very messy when it comes to transgender. It's messy because there's a mental component, but there's also a genetic and physical component of it too, where there are people who have different hormone levels, different genetics, and us as specifically OB-GYN sometimes helping parents navigate gender, and even when it doesn't just come to mental, but sometimes babies can have different genitalia, and trying to navigate that for them and help them navigate that. So it can get real messy in these streets when it comes to transgender and gender dysphoria.
Well, I will agree with my colleagues that it's definitely messy. It is messy because of the political environment. It's messy because of the fact that we are on very extreme spectrum when it comes to making a decision or even having an opinion on this subject. And for that reason, we need to work hard on learning more about the best way to handle this fact.
Your turn, Mark. What do you think?
I don't think it's scientific. It hasn't been well studied. I'll even go as far as to say that it probably does more harm by far than any good. So I'm going to say it's not supported. It's fake medicine.
Ooh.
That's right. It's fake, but it's also very messy. So it's messy fake. I made up a new term.
I love the way you
All
said
right.
that.
I know,
So-
you had to save that one. I do think that a lot of these notions go to how people feel, and sometimes the way people feel can change throughout their life. That sometimes when children are young, they may feel a certain way, they may look a certain way, and especially as we develop. When you're younger, a lot of people, they don't develop very sexual characteristics, and we have this thing called puberty. And when you go through puberty, not only do you change hormonally, but you look different, and the way you felt at 5 may dramatically be different than the way you feel at 14.
Right.
And so I think that that's why there's a lot of controversy in the medical community when it comes to people identifying as different genders young, that when it's almost like the caterpillar and the flower, when you hit puberty and things change, it may really rock your world of how you perceive yourself.
Well, I just want to start off by saying to our audience, one, we understand that people come from different backgrounds, and they go through different situations and respond differently. And so I believe there's a lot of trauma and hurt, abuse when we're talking about individuals who are having gender dysphoria. Okay, so I don't want people to be mean-spirited to those who are having gender identity issues or experience gender dysphoria. So let me just start off by saying that I believe that compassion and love will always win in the end. I'm not into criticizing or pointing out an individual that's championing gender dysphoria or transgender issues. We are simply here asking ourselves, is transgender medicine, which includes giving hormones, giving puberty blockers to kids, doing top surgeries to remove breasts, or removing a piece of your forearm to create a fake penis, or removing the penis to create a fake vagina, is this helpful? The whole idea behind transgender medicine and starting them young is essentially to prevent suicides when they get older. So if, little Lisa feels like she's a boy, well, let's block her puberty, pump her up with hormones, do surgery before she goes through puberty, because if we don't do that, she may commit suicide. That's the general gist of it, and that is not well-founded. Now, what do you think, Chris?
I'm very, very supportive of your opinion on this.
Of whose opinion?
On Mark's opinion.
That's right, you
Yeah,
heard them.
I agree with Mark on this.
Yeah, thank you.
Number one, I think we need to, I don't understand the subject very well, but I'm just using common sense, okay? I think that the problem is not well understood. The underpinnings of what causes gender dysphoria, which is a sense of I am in the wrong body, has, like Jocelyn said, a lot of psychological aspects, some physical aspects as well. And I think trying to use medicine to solve genetic and psychological problems has always been very problematic. Like, we don't get the result that we want. Second thing is, I think that there are bigger problems that these kids have that needs to be addressed foundationally. I don't think a young child is matured enough to really understand the implications of the treatment that we're offering them. There's so many questions in my mind, there's so many possibilities for bad outcomes that I just don't think it's a good idea at this point.
I'm going to bring Nick into this discussion. So we were just talking about the treatment. So one of the treatments is, and I see some children and adolescents, but one of the treatments is removal of breast tissue for those for women who want to become look more masculine. And I know that that's usually something that plastic surgeons do.
Right.
Is that something that you do? And it's a personal decision. What's the youngest person that you would feel comfortable doing that on?
So I do some gender affirming surgeries, but not on kids. I don't think it would be fair to do something that's permanent for a child. Like, even as an adult, the way I feel today isn't the way that I'm gonna feel maybe 5 years from now. Marriages. The person that you marry 10 years ago isn't gonna be the same person 2 years, or 5 years. And so, as a child, I just don't feel like they have enough. They really can't give informed consent. If they're an adult, that's a whole different scenario. And even with adults, with these gender affirming surgeries, even after they've had the surgeries, they have a high suicidal rate.
Right. What Nick said was important because it's going to segue into what we're about to discuss. But informed consent. So what that means is when you are consenting a patient for a procedure, they understand the risks, the benefits, and potential outcomes, right? So let's say when we talk to our patients about tying their tubes and no longer having babies, they need to fully understand, after this is done, you're not going to have any more babies unless you decide to go do in vitro fertilization, right? But a kid really doesn't, a 10-year-old, 12-year-old probably doesn't truly comprehend what that entails. So with that said, there is an organization called the World Professional Association of Transgender Medicine, or Transgender Health, WPATH. And these are supposedly the leaders of transgender medicine. and the Society for Endocrinology and Pediatrics, they kind of look to this organization to help deal with patients that are suffering from gender dysphoria. Well, there's a big story it's pretty big, but it just seems to be under the radar, and it's by this journalist. He leaked it. He didn't leak it. He shared it. His name is Michael Schellenberger, and Michael Schellenberger was one of these journalists that were involved with the Twitter files. So just a quick rehash. Twitter files showed that government was suppressing certain speech, certain thoughts, and getting social media platforms to silence certain voices. So a prime example would be when it came to the vaccine. There were people who spoke out against the vaccine, said it was rushed and so forth. They wanted these people to be silenced, right?
Right.
And then it translated into silencing political opponents and so forth, conservative voices or whatever. This was shown that these discussions took place on the internal communications of Twitter. At the time, the mainstream media just said, oh, this is a nothing burger. That was just a phrase I learned at the time, a nothing burger. And I'm just bringing this up because if you fast forward now, there's a case in the Supreme Court that talks about censoring and the government being able to suppress certain points of views on social media. But it's basically suppression of free speech. That's the argument. But it's more than a nothing burger. Well, what he found was this organization, WPATH, the World Professional Association of Transgender Health, they also have their internal documents and communications and Zoom conferences. And what was found is these doctors themselves, or these providers, or whoever is involved, they're questioning what they do, essentially. They're talking about, I don't even know if these kids really understand what they're doing. I can't really give informed consent. Questioning if it's harmful. They've had young children given lots of hormones, developed tumors in the liver. Some have died. They're like, well, we're supposed to be doing this because it's supposed to help with suicide rates, but we don't have any evidence to support that. So again, the whole conclusion of this, it's a long document, it's a lot of videos to look at, but the overall theme is even those providers, that organization is questioning whether it's truly informed consent, if these kids understand what they're doing, if it's actually beneficial, right? Does it help prevent suicide, and is it harmful? And it is harmful because, look, in medicine, if we give a patient too much estrogen, they can get a blood clot, right? We worry about strokes. We've had studies where we worry about strokes by giving estrogen therapy. We're talking about puberty blockers, right? There is a time and a place for it, like in precocious puberty, but we try not to give puberty blockers for too long. It decreases bone density. It can stunt growth. There's a lot of harm that we know these medications can do and these treatments can do, and their files, their internal communications suggest that they admit that.
I applaud this organization for even having this discourse. I think they were trying to leave it private and it got exposed, and all that's done in the dark will eventually come to light. We as doctors, we all take our oath that we're trying to do no harm.
Correct.
And I think that many times we are trying to do what we think is right. And when you have a situation where somebody's telling you, I don't feel like I'm in my right body, I don't want to be a girl, or I don't want to be a boy, and you're thinking, if I do this, I'm going to help them, I'm going to help give them some more time until they can figure it out. Or, they don't like their breasts and they're ripping them off, or they're doing different things. And so I don't think that any of the people who are doing what they're doing it are doing it in a way to harm them. But sometimes when you try to help, you might actually be harming. And so I think that trying to, unfortunately, evidence-based medicine is how you figure it out. Unfortunately, we live in a litigious society. So when all these studies come out, and when they realize that it's possible that these doctors caused harm, I think a lot of them can become fearful that even though they had all the consents in the world, that these people will go back and sue and say, you did this surgery to me, and now I'm scarred for life and I have all these problems. So I do think that many physicians and this is also with the political climate that many people foresaw this. They foresaw giving these kids all these puberty blockers and things could possibly be harmful, and we did not have enough research and evidence base before you start doing all these things that it could be harmful. And that's the importance of dispelling fake stuff, getting the fake stuff out, that you, oh yeah, if you do this immediately, this is gonna decrease suicide rates. We don't know. Have we done the research that doing all these things is gonna help these kids? No,
Nick, can you tell us about the phalloplasty? That's where a female wants a fake penis, I guess. Like,
Yeah,
what does that
so-
procedure entail?
So those gender affirmation surgeries, they call them bottom surgeries. And so female to male is more complicated. And typically it involves like a team of different specialists. So you may need a gynecologist,
Urologist.
a urologist, and a plastic surgeon who specializes in like microvascular surgery. So the phalloplasty, first for female to male, they need a construct for the shaft. So the shaft usually is the radial forearm. So they take some tissue from your forearm, along with the blood vessels and the nerves, because you want sensation. And anastomosis are connected to some blood vessels in your pelvic area. Sometimes these patients, they have a hysterectomy prior to this. Sometimes they have their ovaries removed. I don't think you have to have your ovaries removed, but that's part of the procedure. You have to recreate you have to make the scrotum, and then they use a prosthesis for the testicles. And then at the same time, the urethra, you have to lengthen the female urethra to fit into this construct. So it's usually staged. They do one part of the procedure, and then they may come back like 4 to 6 months after. And not only the surgery is very complicated, they can also end up with complications. So
Is it a high rate of complication? Because, again, we always...
there are some complications that, sometimes, you can have a urethral stricture, lose some skin. So they usually stage it.
So urethral stricture is basically where they pee, it gets closed off so they don't
Right.
have problems peeing.
Right.
Okay.
So they put in a stent. Usually, they have a stent in, and the stent is taken out after a period of time. Now, mind you, I don't perform the surgery, but when you're having the surgery, most of these centers they want you to stay there for like a month.
Ooh.
Yeah, just so they.
Oh my goodness.
Yeah, because they want to make sure everything goes well, and if you have a complication, they need to be able to get to you quickly. And so prior to these surgeries, they actually have to have a pretty lengthy, detailed psych workup where they get approval or clearance by 2 psychiatrists. It's a pretty
Sounds
lengthy
like
workup.
this is not a kind of journey that you want a kid to be going.
No, absolutely.
Right.
I don't
So-
think
I don't
I've
think do
never
them
heard
for
of
children.
anyone doing bottom surgery on a child.
Well,
I do think they do the breasts.
They do puberty blockers and try to prevent
Yeah.
breasts from forming, but still, even the medications themselves, they're not without risk. They are without harm. But the bottom line is the justification that's used is, again, a prevention of suicide, right? But I would say Denmark is a country that they were early to accept transgender medicine, transgender issues, and conform as a society. And what they're finding now, looking back, is that, well, you know what? There is a high risk of regret, but not only that, there's also a higher rate of suicide among transgender individuals, the ones that
After the
complete.
transition.
Right.
The ones that we were trying to decrease, and that's what it's all about. Once you, unfortunately, as in science, in medicine, this is what we do. We try something, we come up with an intervention, and sometimes it works well, and sometimes we realize that our intervention actually caused more problems, and then we have
Right.
to sometimes pull back that intervention. And so but you need it can't be anecdotal. And so that's where we love to say, I told you so. I told you that wasn't going to work. We knew that was crazy all along. But if you have people that some people are saying, this is helping me, I love this surgery, it's changed my life, and you have a few people, and well, I said it wasn't, the only way you're going to be able to sort it out is to show the numbers. And I think Denmark, like you said, has shown the numbers, and maybe the more information we have, and hopefully they can stop suppressing the numbers, and we can get the true facts and get what's real, and we can stop being anecdotal and say, this is actually saving lives, and this is not saving lives.
I agree.
Yeah, I think, from a professional standpoint, we just know that some of the treatment modalities are harmful. I don't think there's enough evidence to show that there's a benefit, especially with a young child. Like young kids, they don't know what they want. My kids don't know what they want at this age. They have no idea, what they're asking for. And part of treatment options is just patients being informed, really informed and understanding. And I also think that some of these parents, they don't understand it. They don't really truly understand the ramifications. But I also feel that we're just in a society now where it's like vogue, like transgender, gender dysphoria, gender fluidity is like vogue. And I mean, I think sometimes parents even push their kids and try to force their kids to do this. My take is it's harmful. I don't think kids should be doing it. I think it's proven, there's no evidence that it's beneficial. And we know these procedures have risks. The one you explained sounds very risky. So it's something that should be considered in the public dialogue, but with respect and kindness, because I've seen it get pretty ugly out there. We don't approve of that, but we can still keep it real and talk about the risks and whether this is scientific or not. So that's all we're going to say about this topic. We'll leave all the debates and whether you could be on this swim team or whatever, we'll leave that for other people, but scientifically there's just not enough evidence to support it. And even a bigger story, the organization that is the lead on transgender health, they are questioning themselves and admitting that there's some harm, there's some deleterious effects from
I do
this.
want to just welcome opinion from our audience as well. Professionals who have more information about this condition and how to take care of these patients, and also families and kids that may have personal experiences on gender dysphoria to share their opinion with us so we can better understand the topic.
Yes.
Yeah, I think recognizing that if you have a child who may suffer from that, I think them being evaluated is fine, but I don't think any sort of treatment involving like medications that may affect their growth or any type of procedure that has permanent consequences should be done. I think they should wait until they're an adult to make a actually informed decision.
I agree.
I agree.
Right, and I would just say, children, we have to protect them and do what's the safest thing that we can for them. I think that we do that in all medicine. Children are the ones that we're always very cautious with them, and we need to continue that cautiousness. And I would love to see as many studies as we can done, maybe not proactive studies, but retrospective studies to see what has been done and if it's worked, and looking at other countries, and hopefully people are not hiding medicine for political gains. I do think that right now we're in a zone of a lot of acceptance, and we want everybody to feel heard and feel accepted, but sometimes we have to still protect ourselves and make good decisions based upon evidence-based medicine, not just based upon what's in right now.
Right, and no doctoring the data to, fit
For
a
a certain
certain narrative.
Narrative.
And that's one thing I would warn all medical professionals. We still have respect. If we ever veer off and start trying to fit a narrative and make data fit a certain narrative, we can risk losing public trust, and that would be disastrous. So
Yes.
stick to the data. The data is what it says it is, and just accept it. Right now, retrospective data at least says it does not help in regards to suicide, which is the whole goal of it, right? So we'll leave it there. That's it. Thank you for tuning in to another episode of Messy Medicine. If you have comments, you have questions, feel free to leave them in the comments section. Till next time.